Over the last 3 weekends, Oregon State University students teamed up with healthcare workers have been going to randomly selected homes in Corvallis, offering up free COVID-19 testing.
The participant administers a self-test. So they collect their own nasal swab specimen and put it in a tube, and we retrieve it.
Scientists Jeff Bethel and Ben Diel are both working on the first-of-its-kind project. It's called Trace COVID-19.
And the ultimate goal of it?
To understand the prevalence of the virus in a community, in this case, Corvallis, Oregon.
The teams visited 237 households spread across roughly 30 blocks in Corvallis. 80% of the residents opted to participate in the study, and 455 people were tested. The findings suggest about 2 people per 1,000 in the Corvallis community had the virus when they were tested.
You know, if you randomly selected a person in Corvallis and found out if they had the virus, what are the chances that they would? And so that community level city-wide estimate is 2 in 1,000 from the first week of sampling.
Information that could play a critical role as the state starts to reopen.
It's consistent with the idea that through the immense efforts of the community, social distancing has to some extent flattened the curve. And so that's really encouraging.
But keep in mind, the more the state reopens, the more likely you'll be to run into an infected person.
What if you go to a grocery store that has 100 people? The chances that at least one of them is infected is a lot higher than 2 in 1,000 because you're sort of rolling that dice 100 times.
Which is why the scientists hope to not only continue the study for several more weeks, but also expand it into other communities like Portland. Keely Chalmers, KGW News.